I was in Myrtle Beach with a family trip, and it was a cooking accident, and I was burned 30%, third-degree burns. My lower legs, all the way up to my hip, my abdominal area, most of my right arm, my shoulder, and both my hands. I received a total of, I think, about 12 skin grafts in total. I didn't know if I was going to survive. I don't really know if I was ever in danger of really dying, but I certainly didn't know that. I knew it was bad. But from the moment I arrived here in the ambulance bay, I was met by one of the physician assistants and nurses, and they explained everything to me. And I knew I was going to be okay. They assured me that I was going to be fine. They explained to me what was going to happen from there. And the big thing is, of course, I was down here on vacation without my wife, and they made several calls to her and keeping her up to date, which you can imagine was horrible for her. I remember that next morning they told me I was going to have the first surgery. I didn't know anything about burns. I didn't know about burn care. I didn't know you had to harvest your own. I didn't know anything about it. And Dr. Fagan came in and his team and explained to me exactly what was going to happen that first surgery, and just prepping me for the eventual skin grafts that I was going to have. And again, I don't remember everything, probably because of a lot of the medication, but I think back now is one thing I never had here was pain. I was never in pain. And from the moment I got here, I felt like I was the only patient here. And I spent 21 days in the ICU here. And the relationships that I eventually made with the staff, the nurses, the OT, the PT, the physician's assistants, Dr. Fagan, the resident doctors, I honestly felt like they were genuinely interested in my recovery. And I felt I was in the best place possible that I could. And this is not a job for these people. It's a calling. It's a special person that has to do this. And like I said, I knew I was in the best possible place, and I felt I was receiving the best possible care I could. And again, I felt like they were genuinely concerned. I was in the military, I was in the Marine Corps, and I had a tattoo on my arm here. And when it did, he saw it, and he asked me, "Were you a Marine?" I said, "Yes." He was a Navy corpsman. We're almost the same age, I'm a little older than him. And we started talking about the military. We had been to some of the same places, probably about some of the same times. And, he asked me, he's like, "Well, you burned on your thighs, your legs." And he's like, "Let me see." And he looked, and I don't know if he was measuring or whatever. He said, "I'm not delaying the surgery. We're going to take it off your legs. We're going to get you out of here. I'm going to take care of you." And from that, I was defeated, knowing I was going to have to stay here. I don't know how long my back was going to take, but he was going to let me delay this. The care that we received from here, just some of the nurses, and Mary and Robin and two Amy's and Hannah and the OT, Ishan and the PT, Pam and Seth and Dr. Fagan, and so many of these people we've kept in contact. I came down here, I told Kevin many times that I wanted to come visit, and I meant that, and so we planned a trip here just to come see them. I wanted to look at them directly, tell them how thankful I am.